Hi, I'm Randy Wolken, President and CEO of MACNY and the Manufacturers Alliance for New York State. Today is my Thursday, April 23rd, COVID-19 update. The curve continues on a downward trajectory, and the numbers are down for the 10th straight day. The amount of net hospitalizations and the number of intubations continues to decrease, but there are still new hospitalizations every day. There were 1,359 yesterday. And for the last few days, the number of new hospitalizations has remained flat around 1,350 per day. There were a total of 438 COVID-19 related deaths on April 22nd. Of this, 403 were hospital deaths and 35 in nursing homes. This is a slight decrease from the previous day and has remained generally flat over the last few days. A total of 15,740 New Yorkers have passed away from the virus. The governor indicated that protecting nursing homes is currently the state's #1 priority. The State Department of Health and the Attorney General's office are investigating nursing homes to ensure they have all the regulations and the laws are being followed to protect residents. The state will direct nursing homes to immediately report to the Department of Health actions they have taken to comply with all the directives from the CDC and the Department of Health. If nursing homes are unable to provide adequate care for residents, they must transfer them to another facility. The state is engaging in both diagnostic testing and antibody testing. And diagnostic testing is being used to find positive cases, trace their contacts, and isolate those with exposure. Antibody testing is being used to find individuals who have contracted the virus and recovered in order to find blood plasma donors and to inform the state's reopening strategy. The state has completed a statewide antibody test study in which a random sample of 3,000 New Yorkers were tested for antibodies in 19 counties in 40 localities. Of the individuals tested, 13.9% had COVID-19 antibodies, which means they had the virus at one point but have recovered or were asymptomatic. If the infection rate is 13.9%, the death rate may be lower than some estimates. If these results can be extrapolated to the state's total population, that would mean that 2.7 million people have been infected. With 15,500 deaths in the state, that would be a death rate of about 0.5%. This is only a preliminary data look and may not yet represent the data sets. The results of the antibody study support the governor's regional reopening strategy because areas with high infection rates can travel if you open areas with low infection rates. The governor addressed also comments from the U.S. Senate Leader Mitch McConnell indicating that he believed that states should declare bankruptcy rather than receive federal funding. The governor pointed out that state and local governments would have to find a way to fund police, fire, teachers, and healthcare workers. These workers deserve federal relief the same way that small businesses do. Governor Cuomo urged federal representatives to set aside politics during this time and to address the needs of the states and the nation. In response to a question from a reporter, Secretary to the Governor, Melissa DeRosa, said that the state has paid out $2.2 billion in unemployment so far, which is far more than any other state. New York has paid benefits to 1.1 million people. An additional 207,000 people will be added today. There are some additional guidance from New York City Department of Buildings. There has been no changes in Empire State Development's determinations of essential businesses. There are some updates to New York City agency suspensions and reductions. And there are a list of other related links that you can find on our website to help you keep track of what's going on in the situation. As we just detailed today, the governor is actively talking about regional openings and the path forward for the state. Obviously, the epicenter is still a downstate, and there continues to be a high level of hospitalizations and still a meaningful number of deaths on a daily basis. This will continue to be a conversation in all of New York State. I know at the regional level, we're contemplating plans on how we might reopen, Of course, these need to be approved by the state, and that's part of what we're working on now, is to have an accurate description of what's transpiring in our communities. We met as the McNamee board today and heard from experts from SUNY Upstate, where they described the health situation and the data behind it. I'm hoping to bring additional information to the members specific around what we know within our regions. We continue to remain open and digitally and remotely. We're here to answer your questions as we continue to go through this crisis together. We wish you well, and we want you to be safe, and we'll be here for you through this crisis. Have a nice evening, and as always, be calm, stay safe, and carry on.